In this video, I'm going to be talking about stress during breast cancer diagnosis, treatment, and thereafter. What kinds of stress do we have? How does it show up in our bodies and in our lives? And then some ways to manage stress. If you want to learn more about treatment options that might be offered to you during breast cancer, go to Yerbba.com to get your personalized report. So stress, this is a common word we talk about. Everybody's stressed all the time. When we're going through breast cancer and its treatment, however, stress will be heightened for lots of reasons. One is fear. We're worried what's going to happen to us. Another is management. How are you going to manage your life? The uncertainty of not knowing what's going to happen as you wait, right? You wait from the biopsy till you get the result, and then you wait to see one doctor and you wait to see another doctor. That's very stressful. Doing nothing can feel very stressful because you feel powerless, and we don't like feeling like things are out of our control. Then there are all the people around us, people that we want to have help us who aren't, or people who are over helping, they're over managing us. So it's social stress, it's physical stress, it's that uncertainty, it's being told where to be when. You don't really have a choice of how to spend your time. When they tell you the doctor can see you on this date, you kind of have to go. And that feeling of powerlessness really is stressful to us. How does stress show up in our lives? Well, I'm going to start with cognition, with thinking. We can get the sense of being overwhelmed where we can't even sort of pull the thread that can help us untangle everything going on in our lives. So we just get this sense of so many things that need to be done and we don't know where to start. The other thing is we can have problems concentrating because our mind is focused on what's next with this uncertainty. And if we're really afraid, it can be very hard to concentrate because we're in fight or flight mode. Our nervous system is really jazzed up, and the things that help calm us down seem to have flown out the window. So we can have problems thinking. We can also have problems with sleep. I'm going to go through different ways of managing stress. If there are other ways you notice stress in your body or in your life, feel free to drop a comment. This will help other people who are watching this video know what other ways this might show up and maybe feel less alone. So how can we manage stress? None of us likes to feel overwhelmed. None of us likes to feel like we're not in control. What are some things that you can do? I'm going to tell you a whole bunch of different things that have helped patients of mine, and take what's useful and leave the rest. One thing that's very helpful is to seek social support. Don't go through this alone. Even if you tend to keep things to yourself, find a trusted person you can talk to. That might be somebody on your medical team, but it's also worthwhile having somebody you can talk to late at night when the whole world seems quiet and your mind is just going. If you have a friend who's in a different time zone where maybe it's not so late for them, that's a great friend to reach out to. Always check with them and ask them, is this a good time to talk? Are you in a place where you can hear about my stress? Because we don't want to dump things on people when they're not in a good place to hear it. That can really hurt our friendships. And we want to keep those friends long term. A support group can be really helpful. If you are feeling overwhelmed and you just don't know how to pull everything apart, where you should start, going to a support group can give you some tips and tricks for how to manage all of this. And of course, we've tried to provide some ways to help you cope during particularly stressful times with our videos and our blog posts, and you can check out our Instagram as well, because information can help us feel less stressed. High quality information can help us feel less stressed. Here are some other things you can do that don't require other people. You can move your body. When we get all sort of in that fight or flight mode, what we want to do is help calm our nervous system. And one way to do that is through movement. Whether it's exercise, what you and I might think of as exercise, like walking or getting on a treadmill or an elliptical or swimming, exercise can help, but other forms of movement that you might not think about as exercise can also be really helpful in helping your nervous system calm down. So things like yoga, a very calming yoga, just stretching can help, or moving your body around just to feel how well it's actually working. We can start to feel like we're broken when we're sick, and noticing the things in your body that are working well can be really soothing to your nervous system. Another thing that's been shown to help with stress is writing things down. And I have recommended for some of my patients that they set aside a time to write if their mind is racing or they're stressed that's not at bedtime. Because if you amp up your thoughts and your mind starts racing at bedtime, it's not going to help you sleep. So doing so before dinner or first thing in the morning, or maybe around 6 or 7 at night, before you go into your bedtime routine, just dump everything out on the page. And we have another video on journaling, but just in brief, it's been shown that people who journal about the stressful event, the thing that's on their mind, have lower levels of inflammation in their body. Isn't that amazing? That just making connection of pen or pencil with the page can actually lower inflammation in your body. You might think, oh, I'm just going to type on my computer. And certainly that is helpful, but there's something about connecting your hand to the page. It slows you down a little bit, and it can help calm you down as well. This really works for people. And you don't have to share what you write with anybody at all. This is your inner world, your inner life. So we've talked about finding support. We've talked about movement, whether it's exercise or not. We've talked about journaling. Being outside is really good for stress. There's a gland in our brain called the pineal gland that's sensitive to light. It helps set up our light and dark cycles. And even when you're inside with the brightest lights on, nothing beats natural light. So if you can get outside a couple times a day, even if you're just sitting outside, wear your sunscreen or put on a hat, but being out in natural light can really help with stress. We tend to cocoon a little when we're stressed, and we lose our normal routines. Maintaining a routine of being outside, if you're not working during chemotherapy, if you're a teacher, or you have a job with very little flexibility and you're on medical leave, trying to keep up some routine can help with the stress. I'm now going to talk about professional support for stress. So there are, of course, professionally led support groups, which we recommend over support groups that don't have a professional leading them. There's also individual counseling or group counseling. There are different types of counseling. There's something called cognitive behavioral therapy, which is a long word for managing your thoughts and your behaviors. So we can spin out of control with the stories we tell ourselves. I am a master catastrophizer. I can go to the worst case scenario, and working with a therapist or somebody else trained in CBT can help you sort of pull back on some of those frightening stories you tell yourself in the face of uncertainty. There are other types of support groups and therapy that can also be helpful. One-on-one counseling, whether it's with somebody in the clergy, a social worker, somebody with a PhD or an MD. There are all kinds of people who can provide support. We strongly recommend that you make sure that the person has experience talking with people who have gone through breast cancer, who are living with breast cancer, just because if they aren't experienced, they may be overwhelmed themselves with the idea of talking with somebody who has cancer. As you know, not everybody is comfortable using the word cancer and talking about ways to cope. I have covered a lot in this video. I hope it's been helpful. If it has, click like and subscribe, because that helps other people just like you find this video, and also it'll help us send you, through your subscribing, other videos that might also be helpful to you. You can follow us on Instagram and drop a comment or question below. We try to get back to people as quickly as we can, and thanks for watching.